First, I want to thank all of you, the hundreds, who gave us positive feedback about our first contact. We're going to continue this presentation because I really feel it's needed and there's a lot of useful information that we can share. Let me just start by saying practice management is so important. Your patients do not know whether you missed a root canal or you perforated the root or you did a pulp exposure. They don't know whether you have an overhang or a defective margins. All they care for, that you don't cause them pain, that you treat them with respect, that you treat them with utmost honesty and respect. So what kind of education did we have in our dental schools? Traditionally, universally, globally? This information, I'm not directed to a certain group of people or a certain dentist in a certain country. It's universal, it's everywhere. It's in India, it's in China, it's in Europe, it's in the Middle East. It's in my education and your education. So let's share some information that I observed throughout the years. I'm an endodontist, but you know something? We deal with pain. And the most important aspect of caring for patients with pain, with symptoms, is we did not learn. We did not learn in school. So if we look at the American dental education curricula in general, based on the information we got from the ADA, and still is very valid, in 4 years of dental education in the United States, they give about 5,000 hours of instruction, clock hours, on dentistry in 4 years. Approximately 3,700 of those are on clinical courses, 800 on biomedical sciences, which is so essential, and only 370 hours on research, social sciences, human behavior, practice management, and the most appalling number that I discovered throughout the years, only 60 hours are given on practice management in a typical American dentistry curricula, and 49 hours on human behavior, how to deal with patients, how to deal with patients with emergency, how to deal with patients who are anxious, how to deal with patients who are fearful of dentists. All of this information is documented. It's not mine. It's there. It's in the literature. So in my career as an endodontic dentist, no, I'm not an endodontist educator. I'm a dental educator because I know the relevance between the different specialties. I know the biological, the clinical relevance, and how they all interconnected. And therefore, in teaching at Pittsburgh and teaching in Los Angeles and teaching in Riyadh, Saudi Arabia, in the continuing education courses I've given throughout the world, Japan, Europe, etc., I observed one thing: excellence in clinical dentistry, but no excellence in the human aspect, no excellence in the business aspect, no excellence in the economical aspect of dentistry. And this is when we finished our association with Paddy. I focused a lot of time on the practice management of dentistry, the economic aspect of dentistry. And that's how we really got involved in this area. we were licensed by Penwell International to take the dental economics. Dental Economics is a magazine. It's from 1909, focused on the business aspect of dentistry. So I had the license to translate and republish many of these articles the past 100 years, and I focused on the last 2 decades. And from those, I reviewed about 2,000 articles, and from those 2,000 articles, I got the book, Top 100 Articles in Administration and Practice Management. So this information that I have, we would spend a lot of time putting it together. We published a magazine, and then we stayed online only for this book. This book is dear to me. It's a treasure. There's a lot of information for you as a team leader, as a dentist. It's for you. It's for you to enrich yourself, to self-improvement. It's for you how to lead. And what I have done, in reviewing those 2,000 articles, I was very impressed with quite a few I knew we need them. I needed them as a practitioner, as a general dentist first. No, as a clinician, regardless of your specialty, okay? And every time I read something, I put it together and I put a chapter. It's called Cream to Cream, Zibda to Zibda. In this chapter, we have the bottom line, the conclusion, what I call the Abourass summary. We have Abourass summary in endodontics, Abourass summary in practice management, Abourass summary in diagnosis, etc. So the book summarized totally in 6 chapters. A chapter on leadership and management of dental practice, a chapter on self-improvement, a chapter on dental economics, the dental aspect of it, production and profitability, and then the digital technology in dentistry. All of them has one target, is to improve the practice, production, profitability, and the management of dentistry. So who should benefit from this book? Who is this book for? We worked 3 years on it, 3-4 years, and we have it in Arabic and English, okay? And the most important, if you visit my website, you'll see that, and you'll see some issues which we no longer publishing, but you'll see the English copy and the Arabic copy. It's for you. It's for you, the team leader, the clinician, the general dentist, the specialist, regardless of your specialties. I'm talking to you now not as an endodontist, but as a fellow dentist. I want you to understand the business of dentistry. I want you how to deal with envy, jealousy, and ignorance that we see in our profession, whether it's coming from patients or coming from colleagues or coming from the public, etc. I don't want you to burn. I want you to avoid burning as a practitioner. I want you to learn how to lead, how to deal with patients. In the next encounter between us, we'll talk about what do patients want from you. I want you to enrich yourself, improve yourself. This book is good for your office managers. There's a lot of information for office managers. This book is good for dental hygienists. And from this book, actually, I produced 6.5 or 7 hours on how to improve your practice utilizing the dental hygienist, the trained dental hygienist as your right hand. It's good for your staff. There's a lot of information for the dental assistant, the front office, the back office, the coordinators, and all of that. So I hope you will benefit from this book. You know, one of the biggest things that in writing the book, I benefited myself. I improved myself. And that's what I'm doing today. I'm sharing it with you. Thank you for listening. Take care of yourself.